Good afternoon, everybody. Thank you for joining us today. We will be providing updates on our vaccine allocation, as well as some questions that we have received about the Danville Community Vaccination Center. And thank you to the City of Charlottesville for assisting us with the technology support. And so, Joe, when you are ready, if you can pull up the PowerPoint presentation.
Sure thing, 1 second.
Okay, and then I'm joined here today with Dr. Bonds, who is the Health Director for the Blue Ridge Health District, and then also Ryan McKay, who is our Incident Commander for COVID-19 response in the Blue Ridge Health District. And as Joe mentioned, I'm the PR and Communications Manager. And we will go ahead and pass this over to Denise to get started.
Thank you. Joe, if you could advance to the next slide, please. So today what we'd like to update you on is vaccine distribution and allocation, and to remind everybody and encourage them to pre-register in the VDH database, about the expansion of phase 1B, our VAMS update, and just a touch on the Danville Community Vaccination Center, because we know there's been so many questions in our community about that. If I could have the next slide, please. So this week, our vaccine allocation is as follows. The health department received 1,300 first doses of Moderna and 1,100 second doses. Additionally, we received 2,340 first doses for Pfizer. We have a little bit of Johnson & Johnson that is available to us for some vaccination this week, but it's not a sustained amount. UVA is now receiving their own allocation. Previously, the health department determined how much they would receive. That now has been turned over to the state level. And that is true not just for UVA, but for all hospitals in the state. And UVA at Seminole Square will have 2,510 first doses of Pfizer, 1,170 second doses of Pfizer, and 1,110 Moderna second doses. So that is what will be given across the health district this week. And if we can have the next slide, and then I'll let Ryan talk about pre-registration.
Thank you, Dr. Bonds. As many of you know, we as a state moved to a pre-registration system where individuals could provide information about themselves and expressing their interest in getting vaccinated essentially at their own health district or in other locations across Virginia. Why this is important, one, obviously we want to understand and know who wants to get vaccinated, but it's also important is because this helps determine allocation of vaccine to health districts across Virginia. And so that data that's pulled from the VDH or the state database helps inform the actual number of doses we may receive from 1 week to the next. So by making sure that you're putting your name and your contact information into the system, one, it provides us with the right information for individuals who want to get vaccinated so that we can upload your name into the vaccine administration management system so you can actually schedule an appointment. The other is it informs decision-making about how vaccine is going to be allocated to health districts. And so we have to use this data as a way to inform decision-making around the amount of vaccine that's going to be made available to any given health district. So it's a pretty critical component, one, to make sure we know who wants to get vaccinated, but two, that we're getting the right allotment based on what the demand is in our health district. So how do you do that? There's a couple of ways. One, go to vaccinate.virginia.gov to input your information, or you can call the hotline using the phone number there, and there are language interpreters available. TTY users can dial 711 to get support. Pre-registration should occur now, regardless of what phase you're in, whether it's 1B, 1C, or phase 2, which would open up to all adults. Getting that in now is going to be really critical for one, again, making sure that we know who wants to get vaccinated and we can contact those individuals to sign up for an appointment. But two, to make sure that we're getting the appropriate number of vaccine available based on the demand that they're identifying in the pre-registration system. Next slide, please. So we, as a state, are operating under different phases. Currently, we continue to run in phase 1B. We've been in 1B since the middle of January. And just something important to remember is that we had to maintain some status in phase 1A because of the number of medical providers that are in our communities. Having the UVA health system here is a tremendous asset, but that also comes with a large number of primary care and medical providers in the community that were eligible in phase 1A. So in comparison to many other localities and health districts in Virginia, it took us a little bit longer to get through the phase 1A group, but also the phase 1Bs. And so that delay and that time that it takes to get through these two phases also means that we're going to be opening up to phase 1C a little bit later than some other health districts, as they are beginning to open up, depending on where that location is, what their population is. And so the decisions about moving from one phase to the next is really a local decision made by the health districts based on their demographics, on their population, and how quickly they can move through those different groups, because it's all very dependent on a local need. So one of the things that we're going to be doing is opening up to all of phase 1B. And what we want to do is make sure that we are able to provide this group with enough time to identify and schedule appointments in the Vaccine Administration Management System, or VAMS, before we move into phase 1C. And I think it's important to understand that as you make appointments, those appointments may be available next week, or it may be 3 or 4 weeks from now before you can schedule an appointment. But the goal here for phase 1B is to schedule those appointments before we begin to open things up to phase 1C. And the same will be true when we do open up to phase 1C, to go in and schedule appointments to make sure that you're getting that appointment before we open up appointments to all of phase 2. Again, we're moving to the VAMS for the scheduling system. We started using that in terms of our clinics as of Tuesday. We are in the process of uploading and communicating to individuals that they are now eligible to schedule an appointment for the VAMS system. Clinics in the VAMS system are available not just for our location here in Charlottesville, but across the district. And we're extending those clinic opportunities out at least through April, and we'll add more through May and June as well. So there are enough opportunities for people to schedule before we move into the next phase. A couple of key things. So it is an email that's going to come to an email box, and you have to make sure that you've checked your promotions boxes, whether that's Gmail or Yahoo, your spam folders or junk folders. Depending on the service provider you use for your email, it may end up in a location other than your inbox. So it's important to make sure that you check those locations for those invites. Something else that's important to remember, we are taking phone registration. So for individuals who do not have great access to technology, aren't comfortable using the systems, you're welcome to call our hotline, and we can work with you individually to try to schedule appointments moving forward. Next slide, please. And I'll turn this back over to Catherine.
Great. And in regards to the VAM system as well, individuals who pre-register in the state system and identify that they prefer phone will receive a phone call to get scheduled. So our hotline and our schedulers will call them. Everybody else who has identified email will receive the email invitation from VAMS, which will come from a cdc.gov email account. So it doesn't come from Blue Ridge, but it's coming from the CDC. Something else that we've also received a lot of questions about recently is the Danville Community Vaccination Center. So this is a large vaccine clinic that's occurring in Danville, Virginia. We've heard of a lot of different community members and students driving down to Danville to get their first dose of a vaccine. And we've also heard from folks who are requesting that they can get their second dose here in Charlottesville. And unfortunately, we're really happy. We're very excited that everybody is able to get vaccinated, and that's the goal. We want people to be vaccinated, and we understand that it's hard to be patient and wait for the vaccine supply to increase in the health district. But given the limited vaccine supply, we are unable to provide second doses for individuals who are going to these larger vaccination center clinics. And that's because our vaccine supply for second doses relies on how many first doses are administered in our health district. So unfortunately, we're not able to provide those second doses, and want to make sure people are aware of that. Additionally, we've heard about questions about unused vaccinations occurring at this site, and we've been assured that our state office is working with the contract company that's helping with the Danville Community Vaccination Center to make sure that no vaccines are going to waste. And Joe, you can go to the next slide, please. And those are the biggest updates we had to share with you all. I know that you probably have a lot of questions, so we are here to take those questions. As a reminder, we do have our Blue Ridge hotline that's available for any type of COVID-19 questions and needs. This includes continued contact tracing efforts as we still have cases throughout the community, and we can also assist you with scheduling and getting pre-registered in the state system. And that phone number is listed here. If you dial extension 1, that will bring you straight to the state hotline where they can register you over the phone. And extension 2 is for our local Blue Ridge line. So if you're trying to reach us locally, make sure you select 2. Thank you. And we will take questions.
Thank you, Catherine. And at this time, we'll now invite our credentialed media to ask questions. If you would like to participate in the Q&A, please click your raise hand icon and you'll be called upon in the order of hands raised. After I call on you, you can ask your first question and 1 follow-up question. We'll give each media representative 2 opportunities to ask questions in this format. And our first question comes from Macy Moore with CBS 19. I'm sorry, Rachel jumped ahead of you. So Rachel, you are on with the Blue Ridge Health District.
Oh, hello. So my question is, from an equity standpoint, what do you say to people who did travel to Danville this week for their vaccination and, people who were not in phase 1A or 1B?
So I think it's really important to remember that the long-term goal of this is to get everybody in the state vaccinated. And the system was initially set up to try and get those at the highest risk, those in long-term care facilities, those who are working in healthcare, and then those over the age of 65 who we know have the biggest comorbidities when they get COVID. And I think generally across the state, we've been pretty successful in accomplishing that. Certainly, we want to continue all of our outreach efforts, and we have a very strong outreach here in this community, working in conjunction with UVA and our partners at Sentara Martha Jefferson and other organizations across the health district to try and reach those individuals who might have difficulty accessing vaccine because of where they live, or because of technology issues, or because they're at especially high risk. So I think having a large vaccination center is certainly a great thing generally overall. I think that within our health district, we have been very successful at really trying to roll vaccine out in an equitable fashion.
And what do you say to people who are just so antsy to get their first dose, after seeing people who were like college age kids getting their first dose? What do you say to people who are just sitting at home very antsy to get their shot?
Yeah, I know it's really difficult to wait, and I promise that we are working every day to get every vaccine that comes into our health district into someone's arms. We distribute out to make sure that individuals who are partnering with us use up all of the vaccine they get during that week. We make sure that we here at the health department use up all of the vaccine that we get every week, and we work with UVA to make that same assurance that all of the vaccine they get goes into someone's arm. So I would ask people who haven't been vaccinated to, first of all, make sure you're pre-registered. You can go on and check on the state website. Make sure that when you go to check your pre-registration, that you have checked all of the boxes that apply to you. So if you have a job that might put you in one of the higher categories, be sure you've got that checked. And if you have comorbidities that would put you at higher risk and thus at a higher level for vaccination, make sure that you have those checked off as well. And just be sure that we are working as hard as we can to get you vaccine.
And next up, we have Macy Moores with CBS 19. I think we got you now, Macy.
Can you hear me?
We can.
Awesome, thank you. So a lot of people I talked to today, whether they've been vaccinated or not, wherever they were vaccinated or not, a lot of the common thing right now is they don't even know where they stand. They feel like, the district needs to be more clear. Do you think the district needs to make additional effort in sharing certain statistics with the community and be more maybe transparent?
So great question. We certainly encourage everyone to go look at the state website, which does give an account of how many first doses and second doses have been vaccinated. And there are basic demographics by health district of individuals. In fact, you can get the demographics and the vaccination by locality. So you can drill it down to city or county level. And that gives a pretty clear idea of some demographics and how much vaccine. I think we would all like to know where we are on the wait list. And that would be a really helpful item to have. Unfortunately, the state pre-registration system right now doesn't really provide that level of detail. And it's not our registration system. And so we can't implement that kind of change. I think what we can say to everyone is that we will have out this week invitations to anyone who is currently pre-registered in phase 1B. And if you're a phase 1A individual that hasn't got an invitation, we'll be sending those out as well. That doesn't mean that we'll have vaccine for you next week, but it does mean that you will know when your shot is available. And we will be scheduling out. It might be weeks, depending on what we project out for vaccine. We were told that more vaccine would be available. Unfortunately, right now, that hasn't been the case, at least at the local health districts. I think I would also encourage people to use all of the different avenues that they might have available to get a vaccine. So there are independent pharmacies that are available. CVS does provide vaccine, and you can go to their website. Unfortunately, we don't have one universal registration system. And so people really do have to check the other types of registration systems. There are other independent pharmacy chains that are beginning to do the same thing. Walmart also provides vaccine. Some of the Krogers provide vaccine. They may not be in our health district, but if you're willing to drive, I think it's worthwhile looking at those websites as well. And I'll just add that all of that vaccine is coming from the federal stockpile, so it is not part of our local distribution.
And I just want to follow up on your comment about pre-registration. I'm pretty sure Ryan said something in the presentation saying that allocation depends on local needs. So are you guys seeing maybe people are just kind of saying a lot of things, but aren't necessarily pre-registering?
Yeah, it's really important, as Ryan stated, that everyone go online and pre-register. The state is using that to a degree to do the allocations. The state's goal is that we all be able to meet President Biden's deadline of having vaccine available, or at least getting your appointment available by May 1. And, you know, some districts like ours have more individuals that are in phase 1A and 1B. And so we think it's really critical that everyone pre-register, since that's the way the state can easily determine how many people by district are still in those early phase categories. So if you don't have access to the internet, please call. We're happy to get people registered. And again, as I said, please go online and check your registration. You can do that on the website and make sure that you have checked all of the eligible categories.
And next up, we have Jesse Higgins with Charlottesville Tomorrow. Jesse, you are on with the Blue Ridge Health District.
Hello, everybody. Dr. Bonds, you just said that you've not seen the increase in vaccine that you were initially promised. Could you talk a little bit more about that and what that could mean?
Well, we've seen some small increases in Moderna and Pfizer, but it looks like the biggest majority of increase is going to be in the Johnson & Johnson vaccine. We have had some boluses of Johnson & Johnson, so we were able to do a 2,000 dose clinic at Monticello High School earlier in the month. And we are doing Johnson & Johnson clinics in our localities, and we'll be having one next week at the new JCPenney site. We have not yet seen what the regular allotment of J&J is going to be. We were told that it would be quite a substantial amount, but it's not, so far, it hasn't arrived at the health district level yet. I'm sure we'll see it. I think it's going to be a great addition into the armamentarium that we have to get people vaccinated. And we have many people asking for J&J because it is one shot and it is one of those traditional vaccine methods that we're all used to. So I am optimistic that we'll see an increase in the next week or so, but we had really hoped that it would occur last week and this week. And while we've seen some increases, it hasn't been to the level that we would like.
Excellent, thank you. And then my follow-up question has more to do with the pre-registration. Can you tell me what percentage of Blue Ridge Health District has pre-registered at this point?
That is a really great question. And I am going to ask Ryan if he has any indication. It's how many people we have in the pre-registration, or Catherine? I know we were looking at this earlier today.
I know that we have over 35,000 people still pre-registered under phase 1B. I would have to check on how many people are in 1A, and that's 35,000 people in 1B may or may not include everybody who's actually in 1B throughout the health district. So that's why we really want folks to get in there and register so that we can get the accurate number of how many people need a vaccine. And Jesse, if you email me, we can follow up on that and look into that data as well.
And next up, we have Sandy Hausman with Virginia Public Radio. Sandy, you're on. Sandy, go ahead and unmute if you can hear me.
Sorry about that all. Radio people, you know, get freaked out by audio. It's predictable. I was just wondering, you talk about expansion of 1B. Is there someone who's eligible now who wasn't eligible last time we talked?
So I think that's a really great question. I think the state occasionally has added additional individuals into that since our last time. I don't know that anybody has been added. 1B was expanded at the beginning. If you think back way long ago, it really was people over the age of 75, and then that age got dropped down to people over the age of 65, and then individuals between the ages of 16 and 64 with comorbidities that put them at risk of a worse outcome from COVID were also added. So those are really the areas where it was substantially expanded. And we had a lot of people in those categories. This is both a healthcare community with 2 medical centers and a large medical school. And we're also a very desirable area to retire to. So we have lots of people in that over 65 category that we need to work through to get their vaccine.
And just following up, is Danville part of our health district, and why was vaccine available there?
Danville is not part of our health district. It is, for those of you who haven't looked at a map, it's way down at the North Carolina border. Briefly, and if you want an in-depth explanation of where the community vaccination centers, why those sites were selected and how it works, we really would have to refer you to the state and to the Virginia Department of Emergency Management. But VDM and VDH at the central level came together to try and stand up very large vaccination centers. There are a number that are either open now or will be open across the state. There was a selection criteria. I don't have the specific details on how it was selected, but some part of that was at-risk populations and the amount of vaccination that had taken place in those areas, and then population base as well, obviously. So it wasn't an effort on our health department's part. It was an effort at the state level. I'm sure the state would be happy to provide some additional details on how that was selected and the structure behind it.
And
And I
next we
do-
have,
oh,
I'm
Joe, I
sorry.
just want to
Go
add,
ahead.
for us expanding into 1B, part of this expansion as well, that Dr. Bonds mentioned the different criteria and how that changed about a month and a half ago. But additionally, we have expanded to all 1B essential workers. So we were initially working through the prioritization that VDH had outlined of 1B1 essential workers and 1B2, and there was a list of them, and we've now expanded to be vaccinating and scheduling appointments for all workers in 1B. Thanks, Joe. Sorry to interrupt you there.
I'm sorry. Good job. Okay, next we have Sabrina Moreno from Richmond Times-Dispatch. Sabrina, you're on.
Hi, thank you so much. My first question is, I was wondering if you could kind of explain how, people in the district going elsewhere for first dose could mess with distribution within Blue Ridge.
Yeah, so I think that the biggest issue is where they get their second dose at. You have to get 2 doses to get full immunity for both Moderna and Pfizer. And what happened if we have a large number of individuals that got their first dose elsewhere but come to us for their second dose, that's going to reduce the number of first doses that we'll have available for that period of time while we're trying to cover those individuals with second doses. Additionally, the state will have sent that individual's second dose back to where they got their first dose, because that's how the system works. The state says, here's 3,000 doses, and then in 3 or 4 weeks' time, we're going to send you another 3,000 doses to cover those same individuals for their either Pfizer second shot or Moderna second shot. And so if there are 500 Blue Ridge Health District individuals who went to Danville and got their first shot and then come here and expect to get their second shot, it's going to be 500 fewer first doses that we'll have available because their second dose wasn't sent to us. It was sent back to Danville.
Thanks. And I have one last one. I know that Blue Ridge updated its equity policy and that there's a focus on equitable distribution, especially within, with Blue Ridge's COVID demographics. And Danville has a major Black and Latino population. It's a high poverty area. And I was wondering, has Blue Ridge experienced people from out of town accessing doses? And if so, how does that impact efforts to equitably distribute doses?
I think it's safe to say that all health districts have had some vaccine tourism. And I think it depends a little bit on the health district and the populations that surround it. I don't think it's been a huge problem here in our health district. For the most part, individuals that we're aware of that have accessed vaccine were eligible, either because they live in our health district and met one of the criteria, or because they work in our health district and met one of the healthcare provider or frontline or essential workers. But I think you bring up a good point. If there are distribution schemes or equity plans by health district, and there is a lot of vaccine tourism, people from outside that health district coming in, that does make it a little more difficult to execute the plan.
And next we have Brian Mckenzie with the Daily Progress. Sorry. Brian, you're on. Brian, can you hear us?
There we go.
All right. We got you.
Yeah, I've been talking to a gentleman and several people like this, and it's of course all over next door and stuff, but gentleman is 70 and signed up. He's got diabetes. He signed up back in late January, whenever it was open. And finally, he kind of gave up ever getting one and went down to Petersburg, one of these big community vaccination centers. And basically he feels like the vaccination is a Wild West kind of thing where everybody's out for themselves. You have to, you gotta call the CVS, the Walgreens, anywhere in order to take care of yourself. Is that, I guess, how do you guys deal with that? Is that kind of the way it is? Is it really up to the individual to find a place to get it if they are in those sections?
Yeah, I'm so sorry that he had to drive to Petersburg to get his vaccine. There, as I've stated before, there are now several ways that people can get vaccine. And unfortunately, there is not a centralized way that you can sign up for all of those different mechanisms. There are pharmacies, quite a number of them across the state, that are provided vaccine from the federal stockpile, so it doesn't come from the state allotment. And while many of those are working closely with their local health districts, some of them couldn't for a variety of reasons. And so here in our health district, we have a CVS, and I'm really happy that they're here and giving vaccine and providing an additional source for people to get vaccinated, but they have a separate registration system. You know, in an ideal world, there would be one centralized rollout system that worked seamlessly and was equitable and really focused on the highest risk individuals, but it didn't quite happen that way. I think that the good news is that in regards to the state health department, we do have a single pre-registration system, which does allow us good visibility on who is remaining that wishes to be vaccinated, that hasn't had vaccine. And so we really encourage people to pre-register within that system. And I would say certainly look at all of those other vaccination sources.
Brian, did you have a follow-up?
Yeah, actually, that's not so much a follow-up, but I guess you guys started this out, you know, in December with absolutely no infrastructure, no system, no idea what was going to come your way. How hard is it to build up a community vaccination distribution system? I mean, you know, this has to be something that was totally out of your wheelhouse, and apparently the rest of the country too.
You know, I'm going to let Ryan address that since he is our incident commander.
It looks like I came back just in time. So it's tremendously difficult. There is a massive logistics operation that has to occur to build up all of these components. So just thinking logistically of finding the appropriate space and then getting the materials to do that, all of the tables, the chairs, in the new location we're using in Charlottesville, having several thousand feet of stanchions, having the right tables and chairs and signage. That's a pretty big component to how we have to operate to make sure that each space that we use is functional, moves people through quickly and efficiently and safely, but also thinking about the physical and social distancing that has to occur. So that in itself is a massive undertaking. And then the staffing component. So making sure that we have enough vaccinators who are also trained to do that. It took us several weeks to build up to where we could staff to 16 to 17. And now it's taken us a couple of months to get to the point where if we had to, and we had the vaccine, we could staff up to 30 vaccinators and run a 12-hour operation. And so all of that takes time. You recruit people, you try to hire people, all of the administrative components that go into that just for the staffing piece alone requires a ton of individual work power to be able to do that and resources. I think really since the beginning of our response to this, we've probably doubled, if not tripled, our staffing with contract staff to be able to do both ends of the investigation and contact tracing, but also the vaccination piece. And we're hiring more people for logistics. We brought in the National Guard to help with staffing our registration station, our logistics operations. And then there's the whole IT component to this. So, you know, procuring all of the tablets that we have to use at each of the tables when people come through to get registered, having a communication staff. It's a massive undertaking. And I think what's interesting, and this is a quote more from, I think, the federal level, and I can't really attribute it, but for our country, for the state, for the world, this vaccination campaign is probably the largest logistics operation that we've ever had to accomplish, trying to vaccinate in our district at least, 200,000 to 250,000 people within 4 or 5 months is a massive undertaking. It requires a ton of people working on it on the front lines in terms of the vaccination and the site piece, but also behind the scenes to get everything into place and then to keep doing that over and over again. And we've had to utilize partners that we've never actually worked with before, whether it's working with Red Light Management, Skyline, Bama Works to get the tent operated, to working with Richard Hewitt, and then certainly our government partners that we've been working with. It truly is a tremendously large operation that has required the entire community support. And to think about all of those different components that we have to get up and running and moving and also maintain and adjust over time is really challenging. And I'm probably not doing all of, acknowledging all of the things that have to happen. But it is truly a massive campaign. It's not just setting up a site, getting vaccine there and putting vaccine into arms. It truly is a massive undertaking that is evolving as we move forward.
And next up, we have Max Patton with the Cavalier Daily. Max, you're on.
Hello, can you hear me? Great. So it seems like one of the big concerns with the whole recent Danville situation and with vaccine tourism, as you've called it, is that people are frustrated by this ambiguity and this communication, and they're kind of resorting to these unofficial channels, Reddits, big group conversations is what we're seeing, where people are voicing their frustration. What are the methods that you're considering for being more proactive about that and easing people's ambiguities about the system?
Yeah, that's a really great question. And Catherine, do you want to talk about all of the different communication methods?
Absolutely. No, I think that is a good question. And you're right, it is a challenge right now, and people are having to look all over the place for vaccines. And I think part of that is we have a limited vaccine supply and can only vaccinate as many people as we have shots for. The other piece is this questioning where you are in the system. And that's a challenge for us to get that information out, as we don't have the access to that always or resources to be able to tell every individual person in the district where they stand. We've tried to be transparent with being honest about who we're vaccinating and what our vaccine supply looks like. We are sending out messages weekly in newsletters and on social, and partnering with a lot of our community partners like the NAACP and both hospital systems and different groups to make sure that we are reaching everybody throughout the community so that they have all of the information they need. But it is challenging, and there's no one size fits all for this by any means.
Thank you. And my follow-up on that is there any fear of a situation like this happening again, or as the distribution continues, do you think that this is a problem that will solve itself?
Do you mean the situation being people driving to Danville vaccine clinic, or can you explain that more?
Sure. Just with the mass vaccination clinics and the ambiguity of walk-in appointments or not, as the availability becomes more spread out, do you think that's going to be something that happens quickly enough that this is no longer a problem? Or are there any precautions being put in place if it does happen again, if there is word of, say, one of these big vaccination sites supposedly doing walk-ins or not doing them?
I can at least start, and Dr. Bonds, if you have more to share, I think it's certainly possible that this could happen again. Our health district has worked hard to try and make it equitable in our distribution plan so that we are doing invitation only and appointment only right now. We don't have the supply right now to be able to even offer walk-ins, but that could eventually happen as the supply increases and as we move into the different phases. But yes, it is certainly possible that this could happen again. And the important piece behind this is that we want everybody to be vaccinated. It's just a matter of when everybody will be vaccinated, not if. If you want a vaccine, we will make sure you get one. It has to take a little bit of time as it relies on our supply and the vaccine rollout for vaccinating those who are at the greatest risk for death and disease first.
I will just add that the Danville site was really the first community vaccination center site. And with any first large center like that, there are always lots of lessons learned. And I think the state is very responsive to the concerns that local health districts raise. And I anticipate that they will take all of those lessons and adjust their plans accordingly.
Thank you, Denise. And that concludes the first round of questioning. We'll start our second round of questioning. If anybody has a question, please click your raise hand icon. And first up, we have Jesse Higgins with CBS 19. You're on, Jesse.
Hi there. So to kind of address some of those concerns, at least among the students that I've heard from, there was a lot of I guess rumors is the right word, that vaccine was being thrown away in Danville, and that the nurses at the clinic were calling for, more people to come so we don't waste this vaccine. I'm wondering if this is something that, at what point you got a hold of this information, if this is something that was actually happening. Yeah, and if that's still happening.
That's a great question. And I think we all would agree that we do not want any vaccine to go to waste. And that is something that our health district has worked on really hard. We don't want vaccine to go to waste. And we call people at the end of the day when we have any doses, or if we're able to get an additional dose out of a vial, we make sure that we use it. Regarding the Danville site, I will say we're not the operators for that site, so we're not really able to answer that and don't have the information about any vaccine that's gone to waste. I know that our state office is certainly working with the contract company there to ensure that nothing goes to waste, and that's something that would have to be answered by the state level. Sorry.
No, that's fair. Do you happen to know who the contractor is?
I don't, but I can follow up with you, definitely.
I feel like I'm always doing that to you, Catherine. Thank you.
And next we have Macy Moores. Macy, you are on.
Hello again. I just want to say thank you for all of your time today. My last question is there any data on how many people in the district have gotten vaccinated through the federal pharmacy program compared to the health district itself?
That is a great question. And, I don't know that I can answer that question. You can certainly look on the website to find the total number of individuals vaccinated, because that is done by our vaccine immunization system, and it looks at the address of the individual. But it doesn't look at where they got their vaccine. We certainly know the number of vaccines that we have administered, and probably could figure out how many our partners have administered. But again, we don't have a lot of oversight over the federal stockpile program. So Catherine or Ryan, are you aware of any? I just don't think that I'm not even sure at the state level that they could decipher out, for example, CVS, how many of their 100 doses in our CVS per week are going to local residents versus individuals from outside of our health district. Sorry.
It's okay, thank you. And kind of just going off what you said, I just want some clarity, so I apologize if you've already said this. A few people I spoke to today said that you're better off going to pharmacies than your district to get vaccinated. Can I just kind of have a response to that?
I think if you can get into a pharmacy program and you're eligible, that is great. Go for it. But if you have pre-registered on our system, I promise that you will get your invitation at some point. So if you're in 1A, we're trying to pick up any additional 1A people right now. And if you're in 1B, you either have received an invitation to schedule your appointment, or you will receive that invitation in the next few days. And if you're a 1C or a 2, your time is coming. Just please be patient.
And next we have Sandy Hausman. Sandy, you're on.
Yeah, I just wonder, on a slightly different topic, if we've seen all of the variants here in this district, or which of the variants have we seen, and should people be concerned that the vaccine they may have already gotten won't protect against those variants?
So we don't report out variants at the health department level, we report them regionally. There have been a number of variants seen at the regional level. So we're in the Northwest region. I think it's really important for people to continue their mitigation measures, all of those great things that we've talked about. There are ongoing studies right now with all of the vaccines to see how effective they will be against those new variants. But this is a virus, and viruses mutate. That is just what they do. And the more times it's spread from individual to individual, the more opportunity it has to mutate. And so that's why it's really important that people not only get vaccinated, but while they're waiting to get vaccinated, we continue with those mitigation measures, keeping that physical distance, wearing your mask or your cloth face covering when you're out, washing your hands, not participating in social gatherings indoors, trying to keep your gatherings outdoors. All of those things are really critical. So I think we can be assured that there are variants across the state and probably in our health district too. But I think that the more important message is the virus is still here. And every time it spreads, it's another opportunity for it to mutate. And so the critical thing is to stop the spread.
And do you feel a measure of frustration do you feel a measure of frustration in dealing with the state's health department on this whole rollout? It sounds like they've let you down a few times, that you were expecting some things that you didn't get. So I know there's some health districts in Northern Virginia talking about splitting off from the Virginia Department of Health. Do you feel that sense of frustration here?
I think that the state health department has often been a really great partner, and it is fabulous to work with them. And I would say that generally, for the most part, we really love being part of the state. It's a really big organization, and I think communication is challenging for any really big organization. I would say if there are things that have happened that have been disappointing, I don't think they were ever intentional. I think the state is looking at the bigger picture and trying to provide equity across the state and access across the state. And so right now, for us, I think being part of the state is really the right thing to do.
And our last question comes from Rachel Hersheimer. Rachel, you are on.
So is there a way for health districts like BRHD to get more doses from other health districts who just have too many? I mean, do the health districts talk like that if people are not coming to these big vaccination sites to get vaccinated?
That's a great question. So first of all, I assure you that the health directors for all the districts, whether they belong to the state health department or are a local independent health districts, we talk all the time. We have regular meetings and we share best practices and support one another because right now it's a really challenging time. Some redistribution has certainly happened. For example, we have shared a small amount of vaccine very early on when one of our fellow health districts came up short, and they returned that favor for us. So it does happen. I think the important thing to remember is these large community vaccination centers are not really run by the local health department. They're actually run by the state in a combination of the Virginia Department of Health and the Virginia Department of Emergency Management. And so it's a broader organization. We have certainly offered to take any vaccine that they have that they can't at this point in time. So I think in answer to your question, yes, we try and support each other. We certainly try and make sure in a very short term, I think we return favors all the time to make sure there's equitable distribution of vaccine and other resources. But in regards to the community vaccination centers, those are actually run at the state level rather than local.
Thank you.
And that concludes our questioning. So I will hand that back over to you, Catherine, to close out.
Great, thank you. Well, thanks again to everybody who's joined us today. And thank you, Dr. Bonds and Ryan, and a big thank you to the City of Charlottesville, who continues to help us with the technology support for these press conferences. I'm sure we will host another one soon. And again, we appreciate the community's patience with this vaccine rollout. And I'll remind everybody to make sure that you are pre-registered in the system. Those individuals who qualify under 1A or 1B will be added to the VAMS system soon and receiving an email from the CDC to schedule an appointment to be vaccinated sometime soon. And we will continue to provide more updates as we can. So thank you all.